Absolutely. This has been a central area of advocacy within local institutions for developing clear policies and trainings for how to respond. So, first and foremost, clinicians are bound by HIPAA, which is a federal law, and we should never disclose protected health information without explicit patient consent or a valid court order. On a systems level, clinicians really should advocate for leadership within their hospitals and clinic settings to have clear policies that outline how to respond if there is ever a request from immigration enforcement officers within the healthcare setting. So, generally, the policies that I have seen and been a part of creating, the general steps are often to escalate the request to the designated institutional leadership or legal counsel. So that might be a public safety officer, it might be the Office of General Counsel. It all depends on the infrastructure, organizational structure at the facility. And frontline staff should avoid interacting directly with enforcement officers without guidance. And certainly, while those individuals are waiting for a response from their designated institutional leadership or legal counsel, it's important to take an active role in documenting and recording the encounter from a safe distance in case that information will ever be needed in the future. It's important that these policies be created clearly locally within each institution because the people who might be involved, the response steps will look different based on the resources available. But the training should really be disseminated broadly so that the entire staff know how to respond if there ever is a request for immigration enforcement sort of information within that healthcare facility. It's also important to reassure patients that the clinic really prioritizes their safety and confidentiality, and that immigration enforcement is not permitted direct access to clinical spaces without legal authorization. So, again, making sure that patients know that, in addition to the staff, is critical, and that training and preparedness are really essential so that every staff member knows how to respond to those types of requests in order to protect patient privacy.